We want to turn now to the latest on COVID-19 testing across the country. Over 12 million tests have been conducted in the U.S. so far. Our latest ABC News poll found nearly 3/4 of Americans believe we lack adequate testing. And according to this map from the University of Maryland, the light pink states like New York, Illinois, and New Jersey do not have enough testing capacity, while other states say they have plenty, but not enough people showing up for them. Now we're joined exclusively by CVS CEO Larry Merlo, as the pharmacy chain is looking to make testing easier and more widely available. Good morning to you, Mr. Merlo, and appreciate you joining us. There's so much talk about the availability of testing, and CVS began testing in March, and now you're increasing testing capacity. What are your expansion plans?
Yeah, Michael, first of all, thanks for having me. And this Friday, we're going to be opening up another 300 testing sites across 9 states, including New York and New Jersey. And, these are at CVS pharmacy locations. However, they're not inside our stores. They're at our drive-thrus. And individuals can be, tested from the convenience of their vehicle. We plan to have about 1,000 of these testing sites operational by the end of May. And beginning in June, we'll have the capacity to test up to 1.5 million individuals each month. And it's pretty simple. The individual goes on CVS.com. They fill out a simple questionnaire that follows the CDC guidelines in terms of who's eligible for testing. And then it points them to the locale that's closest to them. They can actually schedule an appointment. They come into the drive-thru, and our pharmacist or nurse practitioner provide the test kit through the drive-thru. They provide step-by-step testing instructions. The test is done through the nostrils. The individual actually self-does it themselves, and they put the swab in a plastic bag, in a receptacle. Off to the lab it goes for testing. We get the results back 2 or 3 days later. We notify them and their healthcare practitioner. And again, it's pretty simple and it's very accessible.
You've made it as easy and convenient and as safe as possible, I guess, for all involved. There are places around the country that are still reporting testing shortages. What are you going to do to bring tests to those areas?
Yeah, Michael, great question. And in addition to what I just announced, we're also going into the historically underserved communities. We're partnering with community health centers, the National Medical Association. We're bringing our practitioners into those locations to provide testing for the minority communities. We've seen the population health data that these communities are being disproportionately impacted and affected by the virus, and this becomes an important solution for that.
And what about the supply chain? Are you still seeing stockpiling in your CVS stores? And this is the question everyone wants to know. When can we see the wipes and the antibacterial gel back on the shelves again?
Yeah, the supply chain continues to evolve, and there are many elements of the front store supply chain that are better today than they were 2 weeks ago, 4 weeks ago. But we're still going to experience some spot outages for the next several weeks, and I believe it will be another few months before we get back to the in-stock levels that we had pre-COVID. We're doing a number of things in terms of working with our supplier partners, as well as limiting quantities on, some of those really hot items, the cleaning supplies, the paper products, to ensure that we can supply as many customers as we can with those products. The other thing, Michael, I would touch on the pharmaceutical supply chain, because that is the one element that has not been a problem, and it's a credit to the entire industry, from insurers making it easier for individuals to get their prescriptions refilled, to the work of pharmacies, the work of wholesalers, and the pharmaceutical manufacturers. And today we have 2/3 of our country that have one or more chronic diseases. Those diseases are managed through medication therapies, and there has been absolutely no disruption to that supply chain. And credit to the healthcare professionals involved with that.
Definitely credit to them as well. But before you go, I have to ask you about the federal stimulus. CVS received over $43 million from the federal government, but you're returning it.
Yeah, Michael, we did not solicit those funds. We are a healthcare provider, acknowledging the diverse set of businesses that we operate that go well beyond what we do at our CVS pharmacies. And those funds were distributed to all healthcare providers from Health and Human Services. And, we believe that those funds should be in the hands of other healthcare professionals who need it more. And that's the decision that we're made. And we're proud of making that decision.
All right, Mr. Merlo, Thank you so much for taking your time and joining us this morning. We appreciate it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.